Medicare Advantage versus Original Medicare. What's the real difference? If you think Medicare is simple, think again. Because the moment you turn 65, you face a choice that will shape every hospital visit, every bill, and every decision for the rest of your life. Two options, one run by the government, one run by private companies. Both promise protection, but they work very, very differently. So, what's the real difference between Original Medicare and Medicare Advantage? Let's break it down. Every year, over 65 million Americans rely on Medicare. It's one of the few government programs that most people agree actually works. But in recent years, something changed. Private insurance companies stepped in, turning a public health system into a marketplace. Now, Americans have to choose. Stay with Original Medicare, the government plan that's been around for decades, or switch to Medicare Advantage, a private alternative that claims to offer extra benefits at no extra cost. It sounds great on paper, but as always, the details matter. And here's why this choice is so critical. Once you pick a lane, switching later isn't always straightforward. Rules, timelines, and health conditions can limit your options. So the goal of this video is simple. Give you a clear, calm map before you decide. Let's start with the foundation. Original Medicare is made up of two parts. Part A, which covers hospital care, and Part B, which covers doctor visits and medical services. Together, they form the core of the federal program, straightforward and predictable. You can see almost any doctor in the country who accepts Medicare. Usually no referrals, rarely pre-approvals. If your doctor says it's medically necessary and Medicare covers it, it's typically approved. This freedom is enormous. If the best specialist for your condition is 3 states away, you can go. No chasing authorizations first. Your doctor's medical judgment leads the way. But here's the catch. Original Medicare doesn't cover everything. You still pay monthly premiums for Part B, plus deductibles and a 20% co-insurance on most services. There's no annual limit on what you could spend out of pocket, and it doesn't include routine dental, vision, or hearing, and prescription drugs require Part D. That's why many people buy a Medigap, or supplement plan, to cover what Medicare doesn't. You add up predictable monthly premium in exchange for dramatically lower surprise costs when you actually use care. Think of it as trading unknowns for stability. Now, enter Medicare Advantage, also known as Part C. It's technically still part of Medicare, but it's administered by private insurers approved by the government. When you enroll, the government pays the plan a fixed amount each month to manage your care. In other words, Medicare funds your coverage, and the plan runs the day-to-day, networks, rules, cost-sharing, and extras. Many Advantage plans advertise $0 premiums, dental or vision allowances, gym memberships, even grocery or over-the-counter cards. It can feel like a neat, all-in-one package. But every extra benefit comes with trade-offs. Some plans require you to pick a primary care doctor and get referrals, common in HMOs. Others give more flexibility, PPOs, but still favor in-network care. And because the plans are paid a fixed amount, they have strong incentives to manage costs, which can mean tighter rules around how and where care is delivered. With Medicare Advantage, you usually need to stay within a network of doctors and hospitals. If your favorite doctor isn't in network, you might have to switch or pay much more. Need to see a specialist. In many HMO plans, you'll need a referral from your primary care doctor first. Some PPOs don't require that step, but still pay far better in network. And before major procedures, you may face pre-authorization, waiting while the plan determines if it's medically necessary under its guidelines. Your doctor can support the request, and many are approved, but the review itself can add time and stress. Meanwhile, Original Medicare rarely requires pre-authorization. If your doctor says you need it and it's covered, you usually proceed. It's a difference in process and pace, not just benefits on paper. So, why do so many Americans switch to Advantage? 2 words: free and easy. Commercials promise $0 premiums and extras. And yes, many plans are free to join on top of your Part B premium. But the real costs often appear later, at the point of service, through copays, coinsurance, and benefit caps. Each time you see a doctor, get an MRI, or start physical therapy, you pay a portion. If you have a tough year medically, your out-of-pocket costs can climb toward the plan's in-network annual maximum, which is often in the several $1,000s range. After that, covered in-network services are paid at 100%. On the other hand, someone with original Medicare plus a solid supplement might pay higher monthly premiums, but very little when care happens. So the question isn't which plan is cheaper, it's when do you pay and for what? Here's a simple example. You need a hip replacement. With original Medicare plus Medigap, after your small Part B deductible, most or all costs may be covered. With Advantage, you might owe a hospital copay per day, plus separate copays for the surgeon, anesthesiologist, rehab, and follow-up. If complications extend your stay or add treatments, those copays stack until you reach the annual maximum. Also remember, prescription drugs sit in their own bucket. Whether you have a standalone Part D plan or drug coverage inside an Advantage plan, your medication costs aren't part of the medical out-of-pocket maximum. A big treatment year and expensive meds can hit from 2 directions. Imagine you live in Florida, but your heart specialist is in Texas. With original Medicare, you can just go. Any doctor or hospital nationwide that accepts Medicare. With Medicare Advantage, you're generally better off in-network. Emergencies out of area are covered, yes, but ongoing care typically needs to happen back in your service area or with approved providers. That's why frequent travelers, snowbirds, or people who want the option to chase top specialists often favor original Medicare with the supplement. People who prefer an all-in-one plan, lower upfront premiums, and a single card may lean toward Advantage. Neither is bad. They just optimize different priorities: flexibility versus packaging, predictability at point of care versus predictability in monthly cost. And here's a layer many miss: switching later. If you enroll in Advantage at 65 and years later want to move back to original Medicare with a supplement, in many states, you may need to pass medical underwriting to get Medigap. That can be easy if you're healthy, but harder if your health has declined. Some states offer protections and trial rights, but rules vary. Planning ahead matters. Those extra benefits, dental, vision, hearing, sound generous, but they often come with annual allowances or caps, a limited dental budget, a single pair of glasses, a basic hearing aid tier. For routine needs, great. For major work, limits appear quickly. Another reality: plans update every year. Networks change, copays shift, extra benefits expand or shrink. Your doctor might be a network this year and out next year. That's why the annual enrollment period matters. It's your chance to recheck networks, drugs, and costs, and switch if needed. Both systems were built with trade-offs. Original Medicare offers freedom and consistency, but with separate add-ons and higher monthly predictability. Medicare Advantage offers convenience and extras, but with rules, networks, and service point costs. Neither is perfect. One leans toward control and nationwide access, the other leans toward packaging and upfront affordability. So the real question isn't which one is better, it's which one fits your health, your travel, your medications, and your tolerance for process. And there's a bigger lesson. The system wasn't designed to make choosing easy. It was designed to make every option look safe until you look closer. So look closer. That clarity is worth real money and real peace of mind. Understanding these differences isn't just about saving money. It's about protecting your freedom of care when you'll need it most. Before you sign anything, read the details. Confirm your doctors. Check your medications. Compare the total picture, not just the premium. Because in healthcare, what looks free today may change how and where you get care tomorrow. If this helped you see things more clearly, subscribe to the Savrly for calm, practical breakdowns of how money, insurance, and systems really work. Stay informed, stay covered.